Hi, I'm Dr. Robert Kuhn. I'm here with one of my patients, Kenny Tharp, and Kenny came to us back in March of this year, and he was having a plethora of health problems. And if you don't mind, Kenny, I'm just going to go over a couple of them. You were having chronic inflammation everywhere, problem digesting food, you were dizzy, you had, it seemed like, blood pressure issues, you had joint pain all over the place. That about covers a small list, is that right?
I had all that and much more.
When you were going through that on a daily basis, when you would wake up, what was your life like? What would you think? What were the kind of things that would go through your head?
Well, I've been through a lot of things in my life, but it was just hard to get motivated. Couldn't think. All I wanted to do was lay around. I've had energy all my life, you know. I'm used to going, and I had no energy. I was fatigued.
Yeah.
I just felt like I wanted to give up.
Yeah, and that's, I think that's a key thing to say, because a lot of patients that go through chronic fatigue and chronic illness, they experience exactly what you just said, that feeling of just wanting to give up. And I know when you came in, you told me that you've been going to doctors for a long time trying to figure this out, and you haven't been able to figure it out.
Well, I guess that's why I was about to give up, because I've been going to doctors for, you know, over a year straight.
Yeah.
And they just wanted to put me on medicine, and it just wasn't working.
Okay, so if you remember, and I'm sure that you do, when we started out, we put you through some tests. We did some blood testing, we did some adrenal stress testing, we did food sensitivity testing, and we found out that you had a lot of food sensitivities, and we changed your diet. And it seemed like pretty quickly after that, things started to turn around for you.
Well, you gave me answers.
Yeah.
You know, I wanted to see, you put the puzzle together. Because before that, I didn't know what was wrong with me.
Right.
I was going on the internet, just looking at everything. You know, is it this? Is it that? Do I have this? And by your blood test and everything you've done, you know, it gave me answers. So
Awesome. How do you feel now?
I feel great.
You feel?
I'm totally different than I was 6 months ago.
Yeah, and it's funny, you know, when you first came in, I remember the first several visits, you'd be in my office and say, "Hey, Kenny, how's it going?" And first few responses would be like, you know, I'm doing okay, or I'm having anxiety today, or I'm still tired, or, you know, I feel like crud. And now, just about for the last couple of months, every time I see you, "Hey, Kenny, how you doing?" "Oh, I'm doing fine, I'm doing great, my energy's good."
It's good not to have pain and the anxiety and the fog in the brain. I mean, just being able to function.
How's your future look now?
I'm excited.
Did I pay you to do this testimonial?
No.
All right, well, I appreciate you.
Okay.
Thank you so much, Kenny. I'm glad to be your doctor. It's a pleasure. Thanks.
Thank you.